So now we're going to move on to some practical strategies that you can use within your supervisory sessions. First, kind of covering some of the basic supervision modalities. Most of us are familiar with individual supervision, where we have one supervisor and one supervisee, maybe typically 1 hour per week across a specified time frame. You may or may not be familiar with triadic supervision. And triadic supervision involves having one supervisor with two supervisees within the supervisory hour. And within this model, the supervisees are allowed more individual time. They get to staff cases. However, the vicarious learning that they experience through observing their co-supervisee experience some of the techniques or do his or her own self-exploration provides invaluable experience. In fact, it allows the supervisee time to reflect and think without having to respond. Similar to what happens in group dynamics, but it's a more interpersonal and intensive learning experience that the supervisees say is so beneficial for them. And this is actually a major model in counseling programs, especially for the first semester of practicum, where it's alternating triadic and group supervision. The last common modality is group supervision, defined as one supervisor with 3 or more supervisees. There are the same limitations that can occur with group therapy as far as the effectiveness of group. There's pros and cons. Again, the vicarious learning, the mutuality, the sharing across time and development of the group dynamics that can be therapeutic according to Yalom's therapeutic factors. However, there are limitations in that some of the individual attention to cases is lost. However, I believe group supervision is vital if any of your supervisees are leading group. Remembering that supervision is the isomorph, and there's this parallel process. So you facilitating group supervision will also be modeling how to facilitate group, and your same roles of maybe blocking certain members, drawing out some of the silent members is a very powerful role modeling for the group supervisees that is a great opportunity. And let's talk about some specific techniques that you can use in supervision. One of the most common and typically the most used, obviously, is supervisee self-report, where the supervisee brings in their cases, their questions. This is what's going on this week. These are our treatment goals. These are my plans for the next session. Sometimes, however, through no fault of the supervisee, he or she may omit certain details or themes. And they may not know, depending on their developmental level yet, to mention certain issues, may not pick up on certain themes, such as manipulative clients or substance-using clients. So this is why some of the following techniques, as opposed to self-report, are so important. Tape review is crucial in really being able to monitor the supervisee's skills, whether that's videotape review, audio tape review, but being able to both you yourself watch the tapes, but also have the trainee see him or herself on tape, watch what's going on, watch how they are interacting with the client. And of course, we have to be aware of HIPAA compliance and the confidentiality and security of the tapes. So typically, some sites have a requirement that the tapes do not leave the site, they do not leave the area, and this is something and to ensure that they are destroyed and deleted. And I think this can be a challenge in our digital age with iPhones and iPads and laptops being able to tape in different formats. So if you use tape review, making sure that you're monitoring and deleting tapes after they are used. Another supervision technique to consider is case note review. Case note review, I'll give you an example of in a moment, but reviewing the progress notes as that the supervisee is writing up and their documentation. Also, a technique would be to use as process notes. And a process note is going to be the supervisee's written explanation of the content of the session. In other words, it's basically like a reflection afterwards. The supervisee explains what was talked about in the session, but also the interactional processes that occurred between the therapist and the client. The therapist would also reflect on his or her feelings about the client, and also the rationale and the manner of the intervention. And I think that could be a very effective tool in having the supervisee be more intentional about the interventions and the interactions. Another technique is role play, that you and your supervisee engage in role play with certain client scenarios. This is especially effective, again, with trainees in the earlier levels of their autonomy. Role-playing, some of the common fears may be my client gets angry at me, or my client refuses to talk. I can't draw them out no matter what I use. Or my client confronts me, asking me, have I ever been in recovery, or have I ever been in a domestic violence situation? And just role-playing how to handle some of those difficult situations. Another technique to consider is journaling. And this may be, again, depending on your supervisory style and your level of comfort with maybe the counselor role and that personalization, but having the supervisee journal, especially across time, their experiences, their thoughts, their challenges, their strengths as they develop across time, and have that be part of a summative or end paper or project. Another technique is live supervision, and this would be very important in place of audio or videotape supervision, where you actually sit in the session with the client as they're doing their therapy. And you set parameters ahead of time. In other words, you get the permission from the client to participate, explain your role, and say that I may interrupt a couple of times through the session, or the supervisee may invite you in if there's a particular clinical issue that needs your assistance with. Another technique is BITE, which can stand for bug in the ear or bug in the eye. And this may be a luxury only in certain sites or contexts, for example, at a university center where there is a one-way mirror. But a bug in the ear is when the supervisee will be actually in session, the supervisor will be watching behind the glass of the one-way mirror, and the supervisee has a little speaker headset on where the supervisor can actually talk to the supervisee, give suggestions while the session is going on. Another version of that is bug in the eye, where it's the same setup. However, instead of a speaker in the ear, there might be a computer screen that the person can watch, and the supervisor can type comments to that. And finally, IPR, interpersonal process recall, which I'll be talking about here in a couple of moments. So to talk about the case review note example, or case note review example, what I'd like to do is to pause for a couple of moments and give you a chance to read over this case note written by a supervisee. So as you read the note and you are considering then how to process this case note in your supervisory session, you may ask yourself or you may ask your supervisee some particular questions. For example, you might ask your supervisee, to what extent were your objectives for this session met? Or you might say, describe to me some relevant cultural or developmental information as it relates to this client's depression or to this client's functions within this group modality. You also might ask the supervisee or ask yourself, what is this therapist's theoretical orientation? Can I tell by reading this note what is the therapist's theoretical orientation? I might ask you to also consider what's missing from this note. And as you note what's missing, how would you word it? How would you then give that feedback to the supervisee? In other words, typically I try to start with the sandwich approach, with the positive followed by a constructive, followed by another positive. So for example, I would say here that I like the way you qualified your comments about his depression or his appearance by using the as evidenced by. However, I note that in your assessment that you're missing the DSM diagnosis in that, and I think that that would be very helpful to include. But that also I was able to tell by the fact that you used the ABC model that you were implementing some REBT techniques with this particular client. Another comment you might make to the trainee related to this note would be how to reframe from this client looking at a deficits model to maybe more of a strengths-based model. For example, in this note, the trainee had the client rate his depression on a scale of 1 to 10, where 10 being the worst or 10 being the highest level of depression. To help aid and in the focus of conceptualization, for example, with this note, you might say, how would this scaling question look from a solution-focused model? For example, with solution-focused, the scaling is kind of flip-flopped, where 10, the highest number, is where the problem is completely gone, and 1 is the worst that it's ever been. Some other questions you might consider in supervision when reviewing a case note is asking, for example, how does this note relate to the client's treatment plan? That if say we were audited and maybe a payer or an accrediting body came in and read this note, would they see that it corroborates and coordinates with the client's treatment plan goals and objectives? Yet another question you could consider in this case note review would be asking again about what cultural factors might be playing a role in not only the client's presenting problem, but focusing on the personalization of the supervisee. What cultural factors of the supervisee might be playing a role in how the supervisee documented what he or she documented, what she noted, what treatment recommendations he or she made. So there's a lot you can do with case note review. You can really get into some rich, deep discussions about some of these. Again, the goal to bring more intentionality and self-awareness on the supervisee's part. I mentioned this a couple of slides ago that I was going to talk a little bit about IPR, or interpersonal process recall, developed by Norman Kagan. And IPR is a technique used during either role play or video or audio tape review. And with IPR, the goal is to use different leads to open up psychological barriers, to open honest communication, and also maybe open honest self-exploration. So some of the IPR leads, again from Kagan, include affective exploration, asking questions like, how did that make you feel? Or what do those feelings mean to you? What did you do or decide to do about the feeling you had in that moment. And again, these would be leads where you could stop the tape, you could stop the role play, and have that supervisee think about their process and think about their feelings. You might also use leads to check out unstated agendas. For example, what would you have liked to have said to him or her at this point? Or if you had had more time, where would you have liked to have gone? There are other leads in the IPR model that encourage cognitive examination. For example, what were you thinking at that time? Again, not asked in the sarcastic way, like, what were you thinking? Were you able to say it in the way you wanted to? Did you have any plan for where you wanted the session to go next? You might also consider some leads that get at images. For example, were you having any fantasies at that moment? This can be kind of getting into sometimes when the clinician's mind wanders. Were there any pictures, images, or memories flashing through your mind then? Where had that put you in the past when you went off and thought about those images? There's also leads that can explore mutual perceptions between the client and the clinician. For example, what did you think that she or he was feeling about you in that moment? Or how do you think that she or he was seeing you at that point? Was she giving you any clues as to how she was feeling? And there may also be leads that search out expectations. And this relates a little bit to hidden agendas, but what did you want him or her to tell you? What did you want to hear? Or what did you really want to tell him in the moment? And what prevented you from doing so? And this is the interpersonal exploration and intrapersonal exploration that I'm sure you can see how these leads and these types of questions can assist to break down the psychological barriers and open up that rich, deep communication in the supervision session to help facilitate that growth.